this activity, I learned that endocrine system consists of ductless glands. These glands produce chemical messengers called hormones, which pass in through the blood or into the circulation of the body. Uh, Hormones will excite or inhibit the activity of target organs or tissues. Uh, the most interesting part of this activity for me was that when an hormone is present in excess number of receptors, molecules on the target cell will decrease. This downregulation will reduce the responsiveness of the target cells to the hormone. However, when a hormone is at very low level in target level in the blood, the number of receptors molecules on the target cells may increase. This is known as upregulation. As a result, target cell tissue becomes more sensitive to the lower levels of that hormones.
Hi, my name is Giselle, and what I find most important in the application activity was the causes of sterility in men, like overexposure to certain environmental factors and damage related to cancer and its treatment. And in women, the ovulation disorders and the uterine or cervical abnormalities. Also, I find important that if we don't eat healthy food, we can have some complication with our menstrual cycle. And that if we are overweight or we have a low reserve fat, it will affect our menstrual cycle and that affect our hormones and to our body because it's not a normal thing. Thank you.
Hi, my name is Daniela, and what I found important about this project was that all causes that it may occur because of the release of secretions in bad amounts may be less or in excess of some organs that are the pituitary, the thyroid, and pancreas. Also, I found very interesting was all the malfunction of the thyroid gland that they can cause you either obesity or getting you to lose excess of weight. It's very important important to know all this for being thoughtful about your health and what you can do to take care of yourself and your body that may be bad for you in the future.
I think that nowadays in school, the professors or principals don't make such a big deal when talking about sex and disease because now it's normal that teenagers have relations too younger. But then there are programs like 16 and pregnant, and all the fault is of our fathers. The schools need to teach us that we need to wait and have occasions with it, so the population will not grow a lot and there will less people with HTDs. Teenagers don't know how to use protection, or they don't even know that it exists, because the school just teaches the reproductive system but don't say anything about using protection or wait until marriage. They don't even talk about diseases or any problem that sexual relation can cause in our bodies, in our families, or including our social life.
I learned a lot of the research that I did because I got impressed of the high percentage of the obese people that is obese because the malfunctions of the thyroid gland. And that asked me how a little gland can affect the entire body. Other thing that I learned is that the most common diseases of the endocrine system in Mexico is a hypoglycemia and affects in obese people and in some cases to normal people here in Mexico.
What caught my attention in this presentation it was that there's many things that can cause infertility in many women. And then I got impressed by knowing that drugs like alcohol in excess can cause you to get sterile, something like that. And in women, there's many problems So when they may have hormonal problems and other stuff. I don't know. It's really interesting.